Acute Care Nurse Assistant, Module 12, Orthopedic Care. Statement of Purpose. The purpose of this module is to prepare the nurse assistant to recognize the special needs of orthopedic patients and to appropriately perform skills necessary for their care. Terminology. Performance standards. Upon completion of 3 hours of class plus assignments and 4 hours of clinical experience, the learner will be able to define basic terminology, describe the anatomy and physiology of the musculoskeletal system, describe common orthopedic diseases and disorders, and related nursing care, identify common complications of the orthopedic patient, describe the purpose and role of the nurse assistant in performing neurovascular checks. Describe the steps to prevent complications of immobility. Describe the basic principles of traction and the role of the nurse assistant in caring for a patient in traction. Discuss the principles of cast care. Identify and explain the purpose of specific orthopedic devices and the role of the nurse assistant. State types of joint replacements and related care of patients. Explain proper body mechanics when using assistive devices. And describe the role of the nurse assistant in providing care to the orthopedic patient. Content Outline Theory Sections. Section 1. Basic Terminology. Terminology and Clinical Application. Section 2. The Normal Anatomy and Physiology of the Musculoskeletal System. Purpose and Function. Frame, Shape, Movement, and Protection. Normal aging changes. Loss of muscle strength, size, and tone. Slower muscle and nerve interaction. Postural changes. Loss of flexibility in joints, loss of strength in bones, and loss of height. Section 3. Common orthopedic diseases and disorders and related nursing care. Fractures, green stick, comminuted, impacted, oblique, and spiral. Inflammatory disease, rheumatoid arthritis, gout, and connective tissue diseases such as lupus. Assist to maintain mobility, muscle strength, and pain control. Hot and cold treatments. Follow guidelines carefully. Verify exact instructions for any hot or cold treatment, such as the correct temperature, length of treatment, area of body to receive treatment. Clarify operating instructions for any electrical equipment used in hot or cold therapy. Never put hot or cold pads directly on skin. Observe skin for any change in color or texture, burns, redness, blisters every 10 to 20 minutes, per facility policy. Report any complaints of pain, numbness, or burning to a licensed nurse. Never apply heat to an inflamed or irritated joint. Refer this treatment to an RN. Rest, adaptive devices, proper positioning, and range of motion. Degenerative joint disease, osteoarthritis. Nursing care. Prevent trauma to joint. Repetitive stress, obesity, and strenuous activity all contribute to joint disease. Heat. Rest joints. Orthopedic devices and braces to protect joints. Isometric exercises and correct positioning and posture. Reinforce occupational and physical therapy instructions. Assist with ADLs as needed, but maintain independence. And range of motion. Fractures. See the following in this unit: cast care, Section 8, neurovascular checks, Section 5, and complications of immobility in Section 6. Section 4. Common complications of the orthopedic patient. Compartment syndrome. A result of limited space occupied by bone, blood vessels, nerves, muscles, and soft tissues. Occurs after injury that results in swelling where there is no room for expansion, such as a fracture, casts, restraints, trauma, frostbite, orthopedic surgery, or burns. Blood flow is interrupted, resulting in ischemia, muscle damage, nerve damage, and necrosis. Symptoms can be pain, pallor, decreased pulses, paresthesia, such as burning or tingling, numbness or decrease in sensation, paralysis, and weakness. Report any of the above symptoms immediately to the licensed nurse. Nerve damage starts within 30 minutes and becomes irreversible within 1 to 2 hours. Muscle damage starts in 2 to 4 hours. Usual management is elevating the affected area above the level of the heart and perform range of motion. Follow instructions given by licensed nurse. Embolisms, the movement of foreign material, such as a blood clot, fat, or air, to a point where it obstructs a blood vessel. Pulmonary embolism is the obstruction of one of the pulmonary arteries by a blood clot that usually moves up from the deep veins of the legs or pelvic veins. Prevent by applying anti-embolic stockings as ordered. Exercises given by licensed staff, and early ambulation. Symptoms can be shortness of breath, chest pain, cough, sweats, fever, and cyanosis. Dislocation, the displacement of a bone from its normal position in a joint. Symptoms include pain, deformity of a joint or bone. Non-union, failure of the fragments of a fractured bone to heal together. Section 5. The purpose and role of the nurse assistant in performing neurovascular checks. The purpose of neurovascular checks are to detect the early signs of decreased circulation in the affected extremity, prevent damage from pressure on peripheral circulation, and detect changes in nerve stimulation to the affected extremity. Components of neurovascular checks are color, temperature, capillary refill, sensation, edema, movement, and pulse. The nurse assistant's role in neurovascular checks are observation, not assessment. Section 6. The steps to prevent complications of immobility. Cause and prevention of complications related to immobility. Pressure sores. Cause: pressure or friction, such as shearing force, improper positioning, not turning often enough, poor circulation, moisture, dry or cracked skin, irritation from urine or feces, poor nutrition and hydration, and immobility. Prevention: frequent repositioning may need to be every 1 to 2 hours. Prevent friction and shearing during lifting and transfers. Keep head of bed less than 30 degrees unless needed for feeding, treatments, etc. Provide good skin care. Check incontinent patients often. Avoid overuse of soap and vigorous rubbing. Apply lotion to dry skin. Keep linens clean and free of wrinkles. Prevent skin-to-skin contact as much as possible. Never rub or massage reddened areas. and report any signs of skin irritation to the licensed nurse. Hypostatic pneumonia. Cause: immobility, supine position for long periods of time, failure to cough and deep breathe, inability to remove or mobilize lung secretions, decreased fluid intake leading to thickened respiratory secretions. Prevention. Remember the acronym TCDB. Early ambulation, frequent repositioning, adequate hydration, prompt reporting of any signs of change in respiratory status to a licensed nurse. Contractures. Cause: failure to perform range of motion, immobility, joints can stiffen within 24 hours, muscle atrophy, and joint deformity. Prevention. Range of motion, proper positioning, reinforce occupational and physical therapy exercises, support hands, feet, and joints in normal positions. Use footboards, trochanter rolls, hand rolls, and bed cradles. Encourage self-movement for independence. Constipation. Cause: low-fiber diet, decreased fluid intake, inactivity, side effects of medication, aging, ignoring the urge to defecate or not being provided facilities or privacy for a bowel movement. Prevention. Increase fluid and fiber in diet, increase activity, ambulation, up in chair, repositioning. Regular bowel care, such as suppositories and enemas per facility policy. Laxative medications as ordered by doctor, given by the licensed nurse. Review of medications for constipating side effects by the licensed nurse. Provide privacy for bowel movements. Deep vein thrombosis. Refer to Module 4, Section 5. Urinary complications. Cause: immobility. Loss of bone minerals due to immobility can lead to kidney stones. Incontinence and urinary tract infections due to inability to empty the bladder. Prevention. Adequate hydration. Provide frequent toileting measures with proper positioning. Sitting on a bedpan, bedside commode. Men stand at bedside to use urinal, if allowed. Observe for pain under lower ribs in back and blood in urine. Keep accurate intake and output. Depression. Cause: social isolation and confinement, sleep disturbances, confusion and disorientation due to strange place and people. Prevention. Open curtains during the day. Encourage visitors. Group care measures to allow time to rest and sleep. Introduce self and explain procedures. Encourage activity. Provide with reading materials if available. Section 7. The basic principles of traction and the role of the nurse assistant in caring for a patient in traction. Principles of traction. Place a pulling force on bones to align. Immobilize and align fractures to promote proper healing or protect the injury until surgery. Relieve pressure on nerves that may be pinched in a joint. And relieve muscle strains or spasms. Types of common traction: skin traction, skeletal traction, and pelvic traction. Role of nurse assistant in caring for patients in traction: weights off the floor, appropriate patient body alignment, counter traction if ordered, skin integrity, linens off the traction, and integrity of traction. Roles or limitations of the nurse assistant in the care of a patient in traction. Keep covers off traction ropes and pulleys. Check straps and belts for alignment and fraying. Assure that they are smooth and properly secured. Never disconnect weights unless directed to do so by a licensed nurse or doctor, and follow their specific instructions. Do not permit the weights to swing, drop, or rest on any surface. Check any area where the traction equipment comes in contact with the patient's skin for areas of pressure or irritation. Section 8. The Principles of Cast Care. Purpose of casts: to immobilize body parts so a fractured bone will heal. Relieve pain. Allow mobility and limited use of extremity while fracture heals, such as isometric exercises and walking casts, to prevent disuse atrophy. Principles of cast care. Open to air until dry. Handle with palms of hands. Keep linens off of the cast. Turn onto unaffected side. Keep cast dry. No foreign objects placed underneath cast. Protect from soiling during elimination. Keep clean and dry. Elevate with pillow. Observations. Check for skin irritation. Neurovascular checks. Check for odor or drainage. Check for cracks in the cast. Check for rough edges on the cast. Section 9. The purpose of specific orthopedic devices and the role of the nurse assistant. Purpose of orthopedic devices. To assist the patient to function at maximum level of independence. Provide support and alignment, prevent deformities, and improve body function. Prevent damage to joint or body part while healing, after surgery or trauma, and rest inflamed joints while healing. Orthopedic devices. Slings. They support weak or paralyzed extremities. They prevent paralyzed arms from dropping when the patient stands up. The nurse assistant's role is to review correct method for applying the sling before beginning procedure. Place on patient before getting patient up out of the bed or chair. And monitor for proper positioning, circulation, and relief of pain. Abductor pillow. Keeps hips abducted, legs apart after hip replacement surgery to decrease strain on hip. Prevents dislocation of a new hip joint. The nurse assistant's role is to prevent abduction of the hip, keep the abductor pillow in place while turning a patient, support entire leg when turning a patient, reassure patient that the pillow is a protective device, check for pressure areas under straps of pillow. 2 or 3 small pillows can be used when patient is sitting up in a chair. Knee immobilizer. Used to immobilize knee after injury or to support knee after surgery. 2 types. Flexible knee joint and immovable knee joint. Can be complicated to apply. Nurse assistant's role. Many facilities require a specially trained licensed nurse or therapist to apply knee braces. Check with your facility policy. Check skin under the knee immobilizer for irritation and skin breakdown. Areas may need to be padded by a licensed nurse or therapist. Patient may feel off balance when walking with the knee immobilizer. Ambulate patient with care, and only when instructed to do so by a licensed nurse. Cervical collars, used to immobilize the neck in a person with a suspected cervical spine fracture. To relieve neck muscle spasms following trauma or neck strain. To support the head when degenerative disease affects the cervical vertebrae. Stabilize cervical spine following surgery or trauma. After healing of a cervical fracture and halo brace removal, cervical collar is used to stabilize the cervical spine while healing continues. There are 2 types, soft foam collars and 2-piece hard plastic collars, known as the Philadelphia collar. Nurse assistant's role. Check with licensed nurse when caring for patient in a cervical collar. For certain injuries, only experienced licensed nurses should care for the patient. When used for a muscle spasm and relief of pain in degenerative disc disease, follow instructions of a licensed nurse. Facility policies may vary as to the responsibility for applying a cervical collar. Apply collar with head erect and patient facing straight forward. Some fasten in back, some in front. Check with a licensed nurse for proper placement. Observe for airway obstruction and swallowing impairment if the collar becomes too tight. Check with the licensed nurse to see if the collar may be removed for meal times to prevent swallowing difficulties. Immobilization may be ineffective if applied too loosely or positioned improperly. Observe for pain in jaw and collarbone from pressure of the collar, especially hard collars. Pad bony prominences to prevent skin breakdown. Splints. Splints support joints to relieve inflammation and muscle spasms. To rest inflamed joints by limiting motion. To prevent deformity. to support fractured bones until cast is applied or surgery is performed. The nurse assistant's role is to apply splints only when used as supports and only as directed by a licensed nurse. Nurse assistants should not apply splints to unhealed fractures. Review correct method for applying splint and appropriate placement. Check pressure areas for adequate padding. Ask the patient if he or she is experiencing any pain and report complaints of pain to a licensed nurse immediately. Do neurovascular checks every 2 hours or per facility policy. Braces. Support weak or malformed body parts. Prevent or correct deformities and maintain alignment. Prevent movement of joints. Protect soft tissue injuries. Provide protection and healing for minor bone fractures. The nurse assistant's role is to check with a licensed nurse to see if the nurse assistant is allowed to apply the brace. Facility policies and patient conditions may vary. Apply brace over skin that is protected by clothing or use brace that has soft protective lining. Observe skin under brace for reddened areas and skin breakdown. Report patient's complaints of pain to licensed nurse immediately. Observe for proper fit, as some braces need to be adjusted after a period of time. Offer support and understanding to patients who must wear a brace or splint for an extended period of time, especially if it limits mobility and ADLs and alters body image. Continuous passive motion, CPM. It passively flexes and extends knee joint after knee or hip surgery, promotes healing, and limits scarring and stiffness in joint. Patient may be out of the device for meals, repositioning on side and while sleeping. Check with licensed nurse for doctor's orders. Nurse assistant's role. See manual skill caring for patient in a continuous passive motion device. Position patient flat to remove extremity from CPM, or to return extremity to CPM after personal care. Place the CPM on the bed using proper body mechanics and position the patient's foot so that it rests against the support plate. Knee joint should align with the hinge on the leg frame. Secure leg with straps that come with CPM, usually Velcro. Check settings to make sure they match the doctor's order. Turn on the machine and observe patient for 1 full cycle. Readjust for optimal comfort. When leg is out of the CPM, encourage patient to perform prescribed isometric and active exercises. Document amount of time patient tolerated the machine. Section 10. Type of joint replacements and related care of patients. The purpose of a joint replacement and precautions. General precautions for all joint surgery. Observe for signs and symptoms of infection. Use aseptic technique when emptying wound drains. Record accurate input and output. Remind patient of exercises given by physical and occupational therapist. Hip replacement. Perform to relieve pain and improve stability in conditions such as arthritis, degenerative joint disease, fractures, failure of previous hip surgery, congenital hip disease. Precautions. Keep leg abducted at all times. Never allow the hip to flex more than 90 degrees. Keep the leg in neutral position, not externally or internally rotated. Turn patient to the side recommended by the surgeon. Patient must be log rolled and leg supported with pillows to keep the hip in alignment. Observe weight-bearing limitations when ambulating the patient. NWB, non-weight-bearing, PWB, partial weight-bearing, TTWB, toe-touch weight-bearing. Knee replacement, performed to relieve pain, restore normal movement, and correct for deformities for conditions such as arthritis, post-traumatic arthritis, osteoarthritis, and hemophilia. Knee precautions. CPM for flexion of knee. Weight bearing as ordered. Knee brace or immobilizer when up. Elevate leg to prevent swelling. Section 11. Proper body mechanics when using assistive devices. Review guidelines in the use of walkers and canes. Nurse assistant's personal body mechanics as related to the care of the orthopedic patient, i.e., log rolling. Principles and purpose of elevation of extremities. The nurse assistant's role is reinforcing teaching from a physical therapist and reinforcing patient teaching on the appropriate use of crutches. Section 12. The role of the nurse assistant in providing care to the orthopedic patient. Basic observations: the colors of the toes or fingers, the ability to move the tips of the extremities, the ability of the patient to feel you touch affected extremity. Note the temperature of the fingers or toes. Circulation check, movement, and sensation every 2 hours. Signs of infection. Report any differences between the extremities or changes to the licensed nurse. Care measures. Range of motion. Emphasize the importance of ROM as it is often not done. ROM is a skill that nurse assistants can perform that will impact the outcome of patient functioning. Pain control. Refer to Module 4, Care of the Surgical Patient. Body alignment. Incentive spirometer. Turn, cough, deep breathe. Prevent complications of immobility. Section 6. Observe for signs and symptoms of any complications, such as a calf pain, chest pain, or shortness of breath, and report these to the licensed nurse. Continuous passive motion. The equipment is the continuous passive motion machine and sheepskin pads for the unit. Safely care for the patient in a CPM device. Obtain equipment from the storage room. Follow introductory procedure. Knock, introduce self, wash hands, identify patient, explain procedure, and provide privacy. Set up the equipment on the bedside table or at the side of the bed. In many facilities, the doctor sets the initial settings. Licensed nurses will check with the doctor for the length of time the patient is to be in the CPM and explain the purpose, application, and use of the CPM to the patient. The licensed nurse will assess the patient's circulation, sensation in movement, and need for pain medication prior to the application of the CPM. The licensed nurse will instruct in techniques for muscle relaxation and pain control. The nurse assistant will position the patient flat or with head of bed slightly elevated. Lower side rail on near side of bed. Place the CPM on the bed. Use proper body mechanics and position the patient's foot so it rests against the support plate. Check that the knee joint corresponds to the hinge in the middle portion of the leg frame. Use Velcro straps to secure leg within cradle of the frame. Check settings to assure that they match what the physician has ordered. Turn on the machine and observe patient's response to the passive movement. Readjust for optimal comfort if needed. Do not put covers over CPM unless bed cradle is in place or instructed by a licensed nurse. Raise side rail and wash hands. When removing leg from the machine, support the joint beneath the knee and ankle and lift the leg. If the leg is out of the machine, encourage the patient to perform isometric and active exercises, as given by the licensed nurse, physical therapist, or doctor. Record length of time the patient was in the CPM machine and settings to verify that they match the doctor's orders. Repositioning after hip replacement. Equipment: abductor pillow, hospital bed, overhead trapeze, draw sheets, extra pillows. Criteria: turn and reposition a patient 1 day after hip replacement. Maintain hip precautions. Keep head of bed no higher than 45 degrees to avoid hip flexion. Patient should avoid bending over. Keep surgical extremity outwardly rotated. Keep legs apart with an abduction Charnley pillow. Avoid crossing legs. Maintain body alignment. Observe patient for signs of hip dislocation.